Welcome back. We are pleased to have Dr. Anurag Agrawal on the show today. He is a Naples board-certified facial plastic surgeon and current secretary and treasurer of the Florida Society of Facial Plastic and Reconstructive Surgery. Today, he is going to share with us the latest advances in facial rejuvenation. Good morning, doctor. Thank you so much for joining us this morning. Tell me a little bit about your office and why you decided to go into facial plastic surgery.
Well, good morning, Carly. Thank you for having me on your program. I became interested in facial plastic surgery during my training, and over the past 5 years, I've dedicated my practice exclusively to plastic surgery of the face and neck, and I'm double board certified in that specialty. And I feel that specializing in the same area day in and day out enables me to deliver consistently outstanding results to my patients.
Absolutely. There's your contact information, your phone number. Why, we seem to be hearing a lot more about plastic surgery in the media, TV shows. It's being talked, a lot about. Why do you think that is?
Well, I think certainly reality television shows have popularized plastic surgery, but I think this concept of looking your best and that translating into greater self-esteem, greater job success, social success, that's become common knowledge now, and I think patients are appreciating that, and they want to look as good as they feel. And then I think also some of the advent of the newer technological advances in facial plastic surgery, lower downtime, enable people in the workforce as well as just the lay population to enjoy the benefits of facial plastic surgery.
It's almost, in a sense, a lot easier to get done.
Exactly.
Now.
Exactly.
Well, let's go ahead and get to some fantastic pictures of work that you have done on some beautiful. So here's our first picture. Explain to me what you before and after what you did on this beautiful woman.
Well, this is a woman who was 50 before, and she didn't like the appearance of her lower face and neck area. And so what I did on her was I lifted her lower face and neck and also augmented her chin to give her a better profile. So this is her before and after, a lower face and neck lift and chin implant.
That's stunning. She looks fantastic. And then the next one?
This next lady, she was starting to have some settling of the cheek area, so she had an endoscopic mid-face or cheek lift along with nasal surgery or a rhinoplasty. Some people might call that a nose job. But she had both nasal surgery and also improvement of the cheek and neck area.
She looks fantastic.
And then this is an example of a woman. She has a heavier face and neck area, but she was starting to see her face go from more of a heart-shaped youthful configuration into more of a rectangular configuration. So what we wanted to do is bring the cheek and neck tissues up through an endoscopic cheek lift and a neck lift as well.
She really looks remarkable, years younger.
And that's the nice thing about the endoscopic technique. It enables one to get that natural look with preserving your own identity without having any kind of operated on appearance.
And none of those really looked like they had anything done. They just looked beautiful.
Our goal is certainly to have a person or their family members or friends say, you look refreshed, you look good, what have you done, but not come up to you and say, oh, you've had a great facelift. That's certainly not the goal.
No.
So we want to have that kind of inconspicuous look, but know that somebody looks better.
Now, we also have some video, because your office also does some non-surgical procedures as well, right? Explain what that is.
Right, so in facial plastic surgery, there's many different options. If somebody's not quite ready for surgery, then you can have Botox injections, as I'm demonstrating here on a young woman who is having Botox injections to the forehead as well as to the crow's feet at the corners of the eyes. So that's a low downtime, non-invasive procedure, quick results. And then you also have the option of having laser resurfacing performed.
Okay.
And so there's a variety of different in-office lasers done to treat sun damage, laser wash types of procedures, and they're done basically to remove brown spots, tighten wrinkles, that type of thing.
And that's what we have video of as well. Do we have of the laser?
I believe so, yes.
Okay. And so your office really does a lot, kind of, several expertise areas, right?
Right. We cover the whole gamut of non-surgical to surgical options so that a patient has heard all of their, all the possible options that are available to them. And here's an example of that laser wash procedure being done in the office, just on an awake patient with a little.
And what is that for? Is that for the sun?
This is done for sun damage, exactly,
Sun damage.
and fine lines. So.
Which is needed here in Florida.
Absolutely.
Here we are in the Sunshine State,
Absolutely.
which unfortunately we all get a little bit too much sun. All right, and we're seeing a lot of women get things done, but this, your office works with a lot of men as well. This is not just the facial plastic surgery. Men can have this done. There's other procedures that can be done for men as well, right?
Yeah, absolutely. About 80% of our patients are women, but 20% are men, and men tend to be shyer about having things done, but the most common things they come in for are eyelid surgery, neck tightening for that kind of turkey gobbler neck that people complain about, and then of course hair restoration for male pattern baldness. So a lot of times a man's significant other might have something done, and then he may be prompted to also have something done to try to be harmonious with his significant other.
You mentioned hair transplants. We have some pictures of those as well, which is pretty remarkable. Tell us about these.
Well, this is actually a gentleman who had eyelid surgery, before and after eyelid surgery. Just again, one of the most common things that men present for. And then we're going to go on next, I think, to the hair transplant photos. And this is an example of somebody who had a single hair transplantation session to reestablish his hairline and lower his hairline. Example of somebody who had 3 sessions of hair transplantation to really fill in the top of the head there. And you can see that the results are inconspicuous.
So that's 3 sessions.
That was 3 sessions. This is 1 session, a gentleman who had a receding hairline and wanted to have a lower hairline to better frame his face and match what he looked like when he was 30. I think he's about 50 in this picture. And this is lowering his hairline with a single session of hair transplantation. So you create an irregular hairline so that it's virtually undetectable.
Yeah, I mean, that really does look fantastic. You mentioned how, you know, nowadays things are like those procedures are getting easier, and I mean, you can't even tell.
They are. You know, gone are the days in the past of plug-type grafts, which everybody is afraid of, that obvious operate-on appearance. Now, when you look closely, since the hairs are taken in individual follicular units, and something called follicular unit transplantation, the procedure is virtually undetectable and very natural appearance.
All right, we want to go ahead and we're wrapping